One company is on a mission to put 1 million people to work each year. Sounds like a big number, doesn't it? Not to Express Employment Professionals. Maybe you're a skilled welder, or you're an expert in logistics and distribution. We take pride in connecting the right people with the right company. Let us help. We'll open doors for you. Express is on a mission to put 1 million people to work each year.
Welcome to Business Real, and once again, Christy Taylor is not able to join us, but hopefully will be back with us next week. We are at Nash UNC Healthcare, and we are with the CEO and President Larry Chooney and Leslie Hall, who's the Chief Nursing Officer. And we're going to talk, as we do on these shows, about jobs in the area. And if you're thinking, or you have a child who's thinking, what career should I go into? And a lot of people say there are no jobs in town. There are jobs in town. And we're going to talk about nursing shortages. We're going to talk about therapy shortages. But Larry, first off, in healthcare in general, kind of frame what's going on for us, please.
Well, I think we're still feeling the impact of two major issues. One is the Affordable Care Act and all that's done relative to giving people access to health insurance that before the passage of the Affordable Care Act they didn't have. And I think the second major trend is just the aging of the baby boomers. Those of us that were born in the 50s and grew up in the 60s and are now in our 60s and 70s and demanding more health care or have more health care needs. And so that's clearly driving the demand side of the healthcare business.
And so the number of positions, it's an increase that's needed, not just we're having trouble replacing those that are retiring.
Yes, we feel like that over time there will be an increase for the number of virtually every type of healthcare professional that's out there. But right now, the most acute shortage is in nursing.
In other areas, I know UNC and the partnership is very good, and we want to be sure that to share. We were recently all in Chapel Hill kind of hearing from UNC what they provide to our partnership, but that's a good thing, a really good thing for us to, and talk about how they'll be helping us.
Well, I think that, you know, at the very top of the pyramid, there's clearly, I think, a perception, whether you're a patient or you're a healthcare professional looking for a career, that if a hospital is a part of the UNC healthcare system, it says something about the local community hospital and basically the standards that we carry in being a part of the UNC healthcare system. And clearly, it's a two-way street. It's their kind of devotion and resources that are coming our way, and then the standards again that we have to keep as being a part of the UNC system. And it's we could take 3 or 4 hours worth of your interviews if we were starting to describe all of the resources that we're getting from UNC Healthcare right now. But it's just been a wonderful partnership for the first 2 years.
Right, and Dr. Roper, who's the head of the Greater University Healthcare System, multiple titles, Vice Chancellor of this and Dean of the Med School and all. I mean, he just genuinely said he is so happy to have us as a part of that. In the, like you said, the resources and the support, the best practices, the buying discount opportunities. I mean, it really is going to make a difference in the long run. I mean, in the short run, you're seeing some of it, but in the long run, it's just a wonderful thing for us, isn't it?
It is, and I think it's, you know, it is a recognition, I think, of that. The local community hospital is so important to a community, and the community needs to feel like it still controls and has its hands around its local community hospital. But it also is a recognition of there are so many complexities that we have to deal with effectively. That as a standalone community hospital, our vision looking down the road was we just weren't going to be able to do that as a standalone community hospital. And so, we feel like we chose the best partner in UNC.
But also they chose us because they get lots of people, lots of
Yes.
hospitals wanting to be bailed out, lots of hospitals wanting to join. But they look for well-run, fiscally sound institutions, and those are the ones with whom they want to partner. So I really want people to know that this was a real credit to Nash that UNC wanted to join with us and felt really good about it. And Leslie, that came through loudly and clearly, didn't it?
Absolutely. I think they thought that not only our financial position, but the quality of our staff, the quality of our quality performance and improvement programs were very strong indicators of being a good partner for them.
And they continue to want to, add more to us. They're working with cancer care here and other areas where they think that we could use some of their assistance. And for people coming here to know that there's a direct link to a research, top-notch, nationally renowned research institution is just really wonderful for all of us. Great news.
Absolutely.
Let's talk about nursing. I was under the impression that a lot of it might be the retiring nurses, but we need an increase, don't we?
Yeah, it's actually a combination of both. It is about fully a third of all nurses are over the age of 50 and will be retiring in the next 10 to 15 years. So, that's a concern. And on top of that, the growing demand that Larry talked about, the aging population, the baby boomers, improved access to care through the Affordable Care Act is all increasing the demand. Schools of nursing just can't produce nurses fast enough. And unfortunately, a lot of the faculty in the schools of nursing are of that aging population as well. And so many of them will be retiring. So the pipeline is getting clogged. There are not enough spots for as many qualified people who want to become nurses, simply because of faculty shortages. And both nursing and physician training programs are expensive. They're expensive in terms of the clinical supervision that's required and the lower faculty to student ratio that's required. I mean, you can't just put 150 nurses on a nursing unit with one faculty member. It's a 8 to 10 student to one faculty ratio when you're taking care of patients.
Do you find that having Nash and Edgecombe community colleges both train them? Is that of benefit to us?
Oh, absolutely. And in fact, there was a 4 community college consortium until very recently, and they broke apart and they now stand alone. But we rely very heavily on those 4 community colleges. And Nash Community College recently started an articulation agreement with Barton so that nurses who receive a 2-year degree in nursing can then go on automatically to Barton and get a Bachelor of Science in Nursing degree, which is the end goal for many of them.
Does that result in higher pay and more seniority or more knowledge to be able to apply, or what's the advantage of that, Leslie?
Well, the BSN really provides a broader education basis and has opportunity to build in components of public health, leadership development, things that can't be taught in just a 2-year program. So BSN nurses do usually make a little higher salary when they're first hired, and growth opportunities usually require a Bachelor of Science or a Master of Science degree in nursing. So it's a continuum.
Leslie, I want you to give a pitch to the people watching. Why is this a good place to work for people who are nurses? What if somebody's saying, well, why do I want to work in a doctor's office? Do I want to work in the hospital? This is a really good place to work. Tell us why.
Okay. Well, it's very fast-paced, for one thing. The patients here have very complex healthcare needs and require complex nursing care. I think we have very reasonable nurse-to-patient ratios, so a nurse can feel like they can do their work and do it professionally to the level they want to do it. Compensation is very good. The retirement program is phenomenal. And so if people are looking for a long career, long, satisfying career in an organization. I think Nash Healthcare can give that to them.
And Larry, when I took a tour with Leslie right out around the whole hospital one day, she knew the name of every single employee. And that says to me that you have people in senior positions here who really, really care. And
yeah, that just means she's a lot smarter than I am.
She is smart. She is smart. But that to me just speaks volumes about what it's like to work here. When senior people know you and didn't look at her, she didn't look at any name tags. She just knew them. And I just thought, wow, that's not the norm. How many people work here?
Yeah, we have about 2,000 people that get a paycheck. If you boil it down to full-time equivalents, kind of the statistical metric of somebody working here full-time, it's about 1,600. But to add to what Leslie said very well, what we tell our new employees is that we hope it feels like family. I mean, that the people that you come to work with, that you're close to, and that you look forward to getting up and coming to work with them every day. And if that's the way our staff are treating each other, then the patients will feel that as well. So we hope we do that.
We've got the Director of Rehab Services, Brian Aiken, join us in just a few minutes. But Larry, what other areas are we needing employees?
I think the most critical shortages are in all the licensed professionals: the nurses, physical therapists, occupational therapists, pharmacists, dietitians. I mean, all of those people are going to be in higher demand in the future than they are now. So that is a very important task for us, that we continue to recruit the brightest and the best that are healthcare professionals.
And with a beautiful new women's center, and of course recently the pediatric emergency room and the other adult emergency room, that facilities like that help attract people, and we're having to provide, or we're wanting to provide more services like in the women's center too, with the neonatology.
Exactly. And I think to the credit of our board of trustees, they have never been afraid of spending money to build beautiful facilities, build adequately sized facilities, and buy the best in equipment. And that doesn't go on at every hospital. So we have a lot to be proud of from that standpoint.
And I toured the Heart Center at one point, and that's got equipment that very few other facilities, heart centers have, right?
Yeah, and we get real excited when the guys from Duke and Chapel Hill and ECU come over and drool at our facility. So we like making them jealous.
Well, good way. And I like sharing with everybody. We are really, really fortunate to have such a great health care, such a great hospital and great care facility here. So spread the good news, folks. We're going to take a break. Larry, I think you're going to head back to work. Leslie, you're going to stay, and Brian's going to join us. So okay. We'll be right back.
Thank you.
Hi, I'm Richard Koss with Allman's Drugstore. At Allman's Drugstore, we are committed to the well-being of your child. Come on in today and enroll your child in our free children's multivitamin program.
If you have children between the ages of 3 and 14, Allman's Drugstores are giving away a free bottle of children's multivitamins every month to each child. Then just return every month for another free bottle. It's just that easy.
And they taste good too.
Also, we offer free prescription flavoring and a lollipop to cheer up your sick little ones. So come in today to either one of our 2 locations for your free children's multivitamin, 3621 Sunset Avenue or 1329 Tarboro Street in Rocky Mount.
Finding the right employee can be demanding. From recruiting to interviews, Express Employment Professionals does the work for you. We get to know your business and who you're looking for. Maybe you're looking for skilled labor. Maybe you need a new executive to join your team. Find qualified people and support using Express for all of your staffing needs. Let us help. We'll open doors for you. Express is on a mission to put 1 million people to work each year.
Brian, thank you for joining Leslie and me. Physical therapist, speech therapist, occupational therapist, did I leave out anything?
You did not. We currently employ, between our outpatient acute care and our rehab hospital, we currently employ physical, occupational, and speech therapy positions here.
And are they all housed in one main area, right? In the day hospital?
The staff are divided up on campus, and we service pretty much every area of the hospital, even into surgery, and our psychiatric hospital we will provide services. So
Oh, good.
the staff are pretty well spread out and diversified through lots of different service areas.
And I guess Leslie was framing nursing shortages as the affordable care. There's more need, the aging of the population. Do those apply to you also?
They absolutely do. You know, with an aging population, you know, we just have more injuries happening and more need for rehabilitation services across all of our areas.
And who trains the physical therapists in our area?
There's several schools in North Carolina. Most locally are Duke, Chapel Hill, East Carolina University, and Winston-Salem State.
And what's involved beyond like a bachelor's degree in order to be a physical therapist?
You know, years ago when I graduated, which was 20 years ago now, you could graduate and practice with a bachelor's degree.
Mm-hmm.
And as things have transgressed, most universities have moved to doctorate programs.
Oh.
So the staff are having to go to school for anywhere from 7 to 8 years to become a physical therapist.
And did they roll into the programs like they often do in pharmacy at Chapel Hill after 2 years, then they can move into it and do 4 more, or does one have to get a bachelor undergrad first?
Typically, the new employees or new physical therapists are getting a bachelor's degree in an allied health field and then moving into a physical therapy program for the doctorate level.
That's a big commitment.
It is.
It is a big commitment.
And it also, that impacts the supply side a little bit, because, you know, again, training fewer to a higher level and at a higher cost. And so that does begin to impact the supply a little bit.
That's right.
Before we started and you sat down, you said we need to grow some.
Right.
Okay, moms and dads and kids. Why? Why is that a good thing?
You know, in our area, we have an area where there's not been a lot of economic growth and we've had a lot of downturn in the economy. And we haven't seen probably as much advancement into our community from other areas since Hurricane Floyd and since several of the things have happened with employers moving out of the area. So in terms of the graduating juniors and seniors coming up, it'd be great to get into an allied health field and pursue a degree in physical, occupational, or speech therapy. You know, working with people and getting a lot of hands-on care with patients is just a great avenue to get into in the healthcare field.
And the pay schedule's pretty good too, isn't it?
It is, yeah.
You want to elaborate on that? Are all three about the same, all different therapies?
They're pretty well on par with each other. You know, a graduating physical therapist today is making $60,000 to $65,000 a year, and that can work its way up into $80,000 to $85,000.
So that's out of school. Well,
That's
that'll
out of
service
school.
some debt.
Yeah,
I mean, that's
It certainly will.
especially with our, you know, among other things, I think our cost of living is less here or lower here than
right.
other places. So.
Yeah, and you know, if getting a doctorate degree isn't for everybody, the occupational therapy and physical therapy both have assistant programs which are offered at Nash Community College and Martin Community College, and occupational therapy assistant is offered at Pitt Community College. So that's an alternative to get a 2 or 3 year degree. You know, the earning is a little bit less, but the school commitment isn't quite as high.
And are you always on the lookout for them also, Brian?
We are. You know, Nash Community College is a gem for our community and for nursing and for therapy. Tammy Clark, Nick D'Amelio, and Andrea Milks do a great job at that program.
Leslie, how will the new health sciences building in downtown Rocky Mount with Edgecombe Community College, do you see that will help be a pipeline to feed more healthcare professionals to us?
I think it won't necessarily be a pipeline to feed more, but I think it will enhance the quality of the teaching and the approach to teaching. The simulation lab will give great opportunity for students to practice in a non-threatening environment, in a safe environment. So I think that's going to be the outcome of that.
Have you seen it? Have you been able to tour it?
I have not. I was aware of the original application and the original plans, but I have not gotten down there myself to see that.
So I think from that perspective too, I mean, we've got a lot of resources. We just need to funnel people into that area. And Brian, I would love for you, kind of like Leslie made, for a pitch, because when people are talking about kids graduating now from various degrees and you know, associate degrees, can't get jobs. You're saying these are areas of guaranteed jobs.
Pretty well. You know, when we're looking for a new employee, you know, our biggest recruitment is our team. We've got a great team of professionals here within all of our service areas, and we have a lot of years of experience within our team. We have a lot of technology here on campus. We have probably one of the most sophisticated electronic health records in terms of documenting and charting and having access to patient information, and also equipment to take care of patients. Our facilities are very modern. We have a lot of handling equipment that takes the burden off of staff having to lift patients and move patients. We have a lot of equipment that'll help ease the burden so you can really focus on the techniques that you're trying to do for helping with the rehab process. So.
And you said you're located in different places, like in Bryant, Aldridge. You've got some, and kind of walk us through all the different sites, Brian.
So the patients will often start in acute care within Nash General Hospital, and we offer physical, occupational, and speech therapy to the patients who are admitted to the hospital. Once they leave the hospital, they could end up going to the Aldridge Rehab Center, which they might end up staying there for 2 weeks, and they could receive physical, occupational, and speech therapy there as well. Once discharged, the patients would move into our outpatient program, which is located at Nash Day Hospital. And in that area, we have physical, occupational, and speech therapy as well. So.
And the equipment, Leslie, that goes hand in hand with other areas that you referenced, including the Heart Center and whatnot. I mean, I don't think that, and I didn't, until I got a little more involved with y'all, but I had no idea that we really do have exceptional equipment here, don't we?
I think we have a very, very thoughtful capital purchasing program, and Nash has always been very wise with their spending, and we look to stay up to date, but we also look for, what is the equipment that will help us to continue to provide the best services here in our community. What do we need to keep people here in this community rather than have to go to Raleigh or Greenville for care?
And that's something I see a lot of people want to stay close to home.
Sure they do.
And so if we can get it not only to save the gas, but your family's here, your support system's here.
And frankly, sometimes when you're not feeling well, when you're sick, it's a long drive, in that traffic to Raleigh and or to Greenville. And so it's about convenience, but it's also, I think, about comfort.
I think I'll echo on what Larry was mentioning, that the health system here is really like a family, and that includes the patients and families that we take care of. So there's just a lot of compassion involved in all the areas of care throughout the entire hospital system.
And the different therapies, people specialize in one area of therapy, right? Do you have more need in one of the areas than others, Brian?
We have needs pretty well across the board. The thing that we do offer here at Nash is we have several therapists that are certified and specialized. Our speech therapy team, we have several staff that are specialized in performing swallowing exams to help the patients that are having trouble after stroke. We have a certified hand therapist who's Stephanie Griffin, and we have 2 certified spine therapists, Elaine Wiesner and Tracy Sandiford. So we offer a lot of specialization for the care that we provide here.
And Leslie, talking about the specialists, y'all have ongoing training across the board, right, to stay current and learn new techniques?
Oh, absolutely. The Board of Nursing does require a minimum number of continuing education hours for all nurses every 2 years when they renew their license. But in addition to that, every time we get a new piece of equipment, a new procedure, a new medication, it requires continuing education for the staff. So we have a pretty comprehensive education department, people that can help do ongoing training here within the organization. But it is not a small effort.
I'm sure. And every time, like you're talking about the equipment, I mean, so that people don't have to, it helps offset the lifting and whatnot to make it easier. But
yeah, in each degree within our area, just like nursing requires a certain amount of continuing ed hours every 2 years. So we offer things on campus, and there's also things that employees will take off campus to help with their certifications and just skill advancement.
Are jobs posted online, or how do people find out?
Yes, they can go to our website, and through the human resource link, they can see all current jobs that are available and apply online.
And are y'all, I think y'all are the second largest employer in town, the school system being number 1 and this is number 2?
That's what I've heard.
And to be that large, and yet really every time I've been here I've seen such a family atmosphere, and everybody enjoys working with each other. It's just a well-run hospital.
Well, it starts at the top, so that's just the expectations that's been set for all employees, and Leslie and Larry and the leadership team does a great job helping to instill that culture here.
Well, I'm sure you do too, Brian. Thank
Yeah,
you.
sure.
Leslie, thank you.
Thank you.
Thank you for joining us. See you next week.
One company is on a mission to put 1 million people to work each year. Sounds like a big number, doesn't it? Not to Express Employment Professionals. Maybe you're a skilled welder, or you're an expert in logistics and distribution. We take pride in connecting the right people with the right company. Let us help. We'll open doors for you. Express is on a mission to put 1 million people to work each year.